yes, you need to do resourcing, but I do a lot less resourcing because I don't need the clients to be able to manage their stuff between sessions that are like a week apart. And so there's a lot less time where the client's in the middle of a target and you have to shut things down because you're out of time and make sure that they're boxed up enough to get to your session next week. You don't spend clinical time doing that. And you also don't need to do as much resourcing because clients just move from where they come in at to not needing all of those coping skills much more quickly. And you only have.
In this video, Sadie Smith explains everything you need to know about EMDR intensives. Sadie has been doing EMDR intensives since 2017 and is now seeing clients only for intensives in her office in Denver. EMDR intensives offer an alternative to the 50-minute model of EMDR therapy. We will talk about the benefits of this new model, some research that supports its efficacy compared to regular EMDR. We will talk about exclusion criteria for EMDR intensives and a lot of resources. To learn more about EMDR intensives, Sadie and Kaylee Smyth-Dent from Scaling Up EMDR have a course on the subject. You can find the link to the course below this video. Here is the interview with Sadie Smith. Sadie Smith, welcome to the Art and Science of EMDR, and thanks so much for joining me.
Super glad to be here.
Sadie, we are talking about EMDR intensives, which you've been doing since 2017, before it became a big trend. And this is your specialty, really. This is most of the work that you do. So I invited you to the show to talk about EMDR intensives, and I want to start by asking you about the definition. What is it? What are EMDR intensives?
Yeah, I think a lot of people that do EMDR intensives will have their own definition for it. I don't think there's a standardized one. My definition is I like to differentiate between the extended session and the intensive. And there's good reason to do both of those. The extended session is when you might be doing a 3 or a 4 hour session, or you might even do an all-day session with a client, but it's part of their continued care. Maybe you're seeing them hourly on a week-to-week basis, and there's a really big gnarly target you want to work through, so you schedule an extended session to work through that, and then you go back to weekly, hourly therapy, which can be a great tool to use. The intensive has a different expectation with it. The intensive is there's a specific goal that you and the client have agreed on ahead of time. And at the end of the intensive, your goal, what you're shooting for, is to have gotten that far in their therapy. So it really depends on what the client is coming in for. And there's different kinds of intensives. The course that Kelly and I put together, Kelly Smyth-Dent from Scaling Up, she and I collaborated on a course on how to do intensives. And we talk about 3 different kinds. Well, first is the extended session, which is not exactly an intensive. And then there's the more recent event intensive that's going to be a shorter amount of time. It might be a half day. It might be 1 to 3 days where you're working with a first responder who needs to clear a lot of their vicarious trauma from their work. And then there's what I call the story clearing intensive, which those are usually between 3 and 5 days, sometimes longer. I've done a 2-week intensive before, where you're really working to clear all the way through somebody's trauma and just clear everything out from childhood forward. And so depending on what kind of intensive you're doing, if your goal is to let's clear all of your work-related trauma, then that's all you're working with. But at the end of that intensive, your goal is to have that cleared for them. And so that's the goal. That's your intensive, is that more current recent event, ongoing traumatic stress intensive, we would call it. Where the goal in the story clearing intensive is that we've cleared all of your trauma, we've done all of the work that needs to happen. Or sometimes I will work with another EMDR clinician will refer somebody to me to do more of an intensive, but based around a really specific piece of a client's story or history that they're having a hard time getting to in hourly sessions, and they don't have the availability in their schedule to do an intensive. And so they'll refer them to me to just work through a certain piece of things. Or sometimes I'll go in and do the childhood story clearing intensive. And then there's more adult maintenance type stuff that they will continue doing. So it really depends on what the goal is. But the definition of an intensive, is to have that specific goal, and your goal is to achieve that by the end of the intensive. Where in an extended session, it's let's get as much done as we can in this amount of time, but then it's the idea that therapy is going to be ongoing, continuing past that. Where in an intensive, whatever the goal is, once you've achieved that, then you're just done.
Yeah. So what I think I hear you saying is that an intensive has a beginning, middle, and an end to the goal that you set for treatment.
Exactly. Where a lot of times in ongoing hourly therapy, we have a beginning, middle, and end. At the beginning, when we start, we envision that that's our treatment plan. But as we all know, it doesn't always go that way. And it can just kind of go on forever, and it can go lots of different places. And that can be really good for clients. The intensive is much more focused. So you really get to that beginning, middle, and an end.
Yeah, I can see how it can be easier to stay on task if someone came for an intensive. So, Sadie, how did you come up with the idea of doing EMDR intensives?
Well, caveat, I'm not the first one to do it. I will give a shout out to Ricky Greenwald. He was probably one of the first ones to start doing intensives. But I didn't find out about him until a little bit later. I was practicing in Montana back in 2015, and Montana is a very rural state. I had a client who was driving 2 hours each way to come see me. And I decided we should at least do as much therapy as she was doing drive time. So on a Saturday, once a month, she would come and we would do that extended session. We just did those 4-hour sessions. And when I started working with more time than just the normal 60 or 90-minute session, I really started falling in love with being able to work that way. And then, of course, she referred a friend to me. So then I had 2 women that were coming for these 4-hour sessions. And I was experimenting with that. And then at that same time, I went out and did my own intensive with Sandra Paulson out on Bainbridge Island, or Sandra Paulson Island in Washington. And that was really, I worked with Sandra for 2.5 days. And we worked through a big chunk of, we did my pre-verbal stuff. And so that intensive had a very specific goal at the end of that. And we had booked 3 days. We only needed 2.5 because Sandra Paulson is amazing. And it was a really wonderful experience. And so that was, working with the longer sessions with a couple of my clients and then doing my own intensive with a very skilled clinician. I really decided I wanted to do that. And so at that time, I closed my practice in Montana and was doing some other things for a period of time. And when I moved to Denver, where I'm at now in 2017, and reopened my practice, I had a very specific goal of focusing on intensives. And that was when I started really looking into, how do I do this? Am I crazy for wanting to do this? I knew I wasn't, because Sandra Paulson was doing them. And that was when I discovered
And she's
that
not
Ricky
crazy.
Greenwald. She's definitely not crazy. She's an amazing clinician and an amazing woman. And that was when I discovered that Ricky Greenwald was doing intensives out in Connecticut, where he's at. I think he's in Connecticut. If I get that wrong, I apologize. And so that was when I started considering, okay, I could actually really do this. And that was when I just started working with clients. And when clients would call me to do regular hourly therapy, I would suggest doing an intensive, and a lot of people started deciding to do that. And I started working with that, and then I just really decided how I wanted to work with that in my practice. And there was some trial and error, and I didn't get it right at first, and had to redo some things about how I structured my practice. But I've eventually come to how I do it now. So it's been a work in progress over the last 3 or 4 years, with some really good inspiration and motivation from both Sandra Paulson and Ricky Greenwald.
Yeah, that's right. First of all, I think we just coined a new term, the Sandra Paulson Island. But I was wondering, Sadie, what are the benefits of working and doing an EMDR intensive, compared to regular EMDR? So I know you said there's beginning, middle, and end, but I'm wondering if there are other things that you see as beneficial to doing intensive work.
Yeah, exactly. And in the course Kelly and I put together, there's a whole thing on the benefits of doing an intensive. But what I find personally is I really get to do the work the way I was trained to do the work. And what I mean by that is when a client comes in, I get to work with the material that they're giving me, their current situation. When we do our treatment plan, we find all of those past memories that are really the roots of what are going on for them, and we can work with that. I get to work with that whole system the way we're all taught that EMDR works, in the AIP, and how the past is maladaptively linked to the present, and the way that works. In an intensive, a client comes in very focused and ready to do that work. And when you're working with them all day, you have enough time to get to 0-7 clear on your target. And you usually get that on a handful of targets in a day. And then they're coming back the next day and you're doing more of that work. And so, yes, you need to do resourcing, but I do a lot less resourcing because I don't need the clients to be able to manage their stuff between sessions that are like a week apart. And so there's a lot less time where the client's in the middle of a target and you have to shut things down because you're out of time and make sure that they're boxed up enough to get to your session next week. You don't spend clinical time doing that. And you also don't need to do as much resourcing because clients just move from where they come in at to not needing all of those coping skills much more quickly. And you only have to get them from one evening to the next morning. So in an intensive, the client comes in very prepared. They've set life aside. They've done the things they need to do ahead of time to be able to just really focus on doing the work the way we know we're trained to do it. And you don't have to do all of that balancing and juggling of, okay, are we going to work on the target that we got part of the way through last time that we need to get back to? Or are we going to work on this crisis that just happened in your life between last session and now? You don't have to do all of that juggling for the clients. So then the benefits for the clients are it's a lot easier on them. They don't have to manage things between sessions. They also can get their lives back and start feeling better in a matter of days or weeks rather than months and months of therapy. And EMDR works so much more quickly than a lot of therapies. We all know that. But in an intensive, it's a whole nother level of that because you're working through all of their stuff in a very concentrated amount of time rather than the hourly week to week. It's also more cost effective for the client because it's something that might take a 6 or 7 hour session doesn't necessarily equate to 6 or 7 hourly sessions because you spend all of that time at the beginning opening a client up and
checking in,
with
how's
them
your
and
week,
checking in.
and
Exactly.
spend, sometimes half of the session closing the session, help the client regulate. That makes, as you talk, I am just, I keep thinking about the 50-minute model, and maybe it's
Yeah.
an old model that we need to challenge that might not
Yeah.
necessarily the best model out there. So I'm wondering, Sadie, if there is any research that shows the efficacy of EMDR intensives when you compare it to regular EMDR.
Well, exactly. There is research. Before I get into that, again, going back to the 50-minute model, that's based in insurance companies and what's billable. That's not necessarily based in what is best for the client or how the model of EMDR therapy works best. There's no research that shows the 50-minute model is best. If there's any research on that, it shows that the 90-minute session is more effective than the 60 or 50-minute session. But again, that's all based in insurance companies and billing. I know the research that's being done that's out there. Part of that, I know some of the research Ricky Greenwald is doing is in an effort to show the efficacy of the intensive model with the idea of helping insurance companies see how much better it is for clients, but also how much more cost effective it is. Because right now, insurance companies won't cover it. They won't cover more than, as we all know, sometimes you have to pull teeth to get them to cover a 90-minute session. And so while insurance companies don't cover it yet, I know that there's research being done with the idea of eventually changing that. And so The research, and before I get into the research on just the efficacy of doing intensives in general, I want to go back to the benefits. And the other piece I want to add to that is the benefits for the clinician, because there are benefits for our clients, absolutely, but there's also benefits for us as clinicians. I find that I enjoy working intensively because I see my clients go from, a SUD of 10 to 0-7 clear on multiple targets over the course of a day or a couple of days or whatever it is. That's much more fulfilling for me, but it's also much less exhausting for me. If I'm doing a 7-hour intensive with somebody, or like if I'm doing a 5-day story clearing intensive and we work from 9 to 5 with an hour lunch, that's a lot of therapy. But I find that 6 or 7 hours of therapy is far less exhausting than seeing 6 or 7 different clients. Or even just 5 different clients, because I'm not having to I'm only keeping track of one person's story, one person's parts, one person's barriers, and all of this stuff that we keep track of, and what works with this client and what doesn't. I only have to keep track of that for one person all day for however many days in a row. And then at the end of that, we're done, rather than having to switch gears every hour or every hour and a half to a whole different person and a whole different set of stories and story and details and parts. And so I find it's a lot less taxing on me. People initially think, oh my God, that's a lot of therapy. That would be so exhausting. Well, it's intensive, but it's far more intensive for the client than it is for you. And you as the clinician are probably already doing that much therapy in a day or close to that. So there's that. And there's also, with the intensive, it really frees up your schedule. Like right now, Rodham, I'm talking to you from Ecuador because for the month of November, I usually schedule intensives on the first and third week of the month, and then I do consultation and things like this on the second and fourth weeks. So the month of November here, I'm working the second week, but it's all online because it's consultation, things like this. I just didn't book intensives for the first and third, and I could take 3-4 weeks off, and I don't have those clients, those hourly clients that are just waiting on me to get back, and their therapy's on hold while I'm on vacation. And so I can take, if I want to, take 6 weeks off, I can do that. If I want to just take 1 or 2 weeks off, it gives me a lot more flexibility in my schedule because I don't have those clients that are waiting on me to come back and finish their treatment. And so it really brings me a lot of work-life balance. So there's a lot of benefits for the clinician. And when the clinician's work-life balance is better, your therapy is going to be better. So that also benefits the clients. So there's a lot of benefits to doing it that way.
Yeah. No, thank you for mentioning that, because initially, when I asked about benefits, in my mind, I was thinking about the client, but obviously there are some benefits for the clinician. For example, you're in Ecuador now, which is awesome. I'm a little jealous. I wanted to ask about, I know you said it's more cost effective and that's in the long term, right? But it's a pretty big investment for clients. And I know people you're in Denver and people come to see you from all over. How do you make sure that the client is a good candidate before they come to the EMDR intensives? I'm wondering if you're using assessment tools like the DES or MID or anything else, and if you have any exclusion criteria. So if you have clients who call you and you do an intake on the phone or on Zoom with them, and then you decide that they're not good candidates.
Yeah, I don't do a lot of assessment on the front end, like as far as sending them tools to fill out, because talking about trauma, filling out forms about trauma activates trauma. So I want to be careful with that. But you also want to balance that with making sure they are a good fit for an intensive, because intensives are not a good fit for all clients that benefit from EMDR. And so what I'm really looking for when I do that initial 30-minute consultation over Zoom or a phone call with somebody, what I'm really assessing is attachment initially, by asking some real basic questions about, tell me what you know about your childhood in those early years. What have you been told when you were hurt? If you fell down, skinned your knee, who would you go to for comfort? And depending on what they tell me there, but I'm mostly using that to determine how much time I need to book them for. But that's also starting to give me an idea of what's going on, along with the story that they're telling me. Now, clients, obviously, they have some level of dysfunction in their life. That's why they're calling in the first place. But I'm also assessing the client's need for skill building and their need for that kind of maintenance of ongoing weekly therapy. Because if that's what they need, or I assess that's what's going to be best for them, or that's what they're asking for, then they're not appropriate for an intensive. And that's somebody that I wouldn't work with in an intensive. But really, it's not necessarily like dissociation is not an exclusionary criteria, because if somebody's dissociative, as you, again, now when we talk about dissociative, somebody that deals with dissociative features, I would work with. If somebody qualifies for a diagnosis of DID or DID NOS, I would not work with that in an intensive, primarily because I don't specialize in DID. And so I can't really speak to that. But if somebody, dissociates when they, or they kind of dissociate when you're working with their trauma, an intensive is a perfect option for them, because you can get them through that and they don't have to manage the dissociation nearly as much. So making that clarification. I find people that if they come with a borderline diagnosis, that's not necessarily exclusionary. It really depends on where they are in their treatment with that. A lot of times, if they're still really actively dealing with a lot of just the management of life that can be difficult, sometimes they get referred to me from another EMDR clinician. And so if they're going to be able to do that continued care with somebody, then I'll do an intensive of let's really clear that childhood trauma that has led to these things that, that basically make up the borderline diagnosis. So I will work with that if they are also in the care of somebody that's going to do that ongoing care that they need, and somebody that has enough stabilization in their life to do the intensive. Somebody that has an active addiction, I won't do an intensive with that. Now, if they have addiction as part of their story, we can absolutely work with that. But if they're trying to get clean and sober, or they're trying to create enough stability, then I'm going to suggest that they work with another therapist, whether they're an EMDR therapist, a talk therapist, or an addiction specialist, to really get that on board before I'll do the intensive. And again, I want to do that in collaboration with somebody who's doing more of the ongoing maintenance. So whether it's ongoing maintenance of basic skill building, or ongoing maintenance of dealing with a borderline personality diagnosis, or just the ongoing maintenance of addiction, again, if they're working with somebody else, I'll do the intensive. But I also find with the intensive, because it is a real investment in time and a real investment in money, a lot of times the people that are calling for an intensive, not always, but very, very often, are appropriate. They have enough stability in their life to be able to make that investment. Because it's not only a big investment of money, but it's a big investment of time. And so that tends to kind of weed out some people that wouldn't be appropriate for an intensive, but you do still have to screen for that. Now, as far as actual screening tools that I recommend, whether you do them before your intake, or I tend to do them more in that first morning. Or if I do the intake with somebody and I have some concerns, I might then have them do the DES. And the other one I like to use is the ACEs checklist. To see what score they get on that 10 questionnaire from the ACEs study. And again, that doesn't necessarily tell you whether somebody's appropriate or not for an intensive, because somebody can have a really high ACEs score and they're a perfect candidate for an intensive, but that tells me I'm going to need to book more time. So I tend to use that, and even the DES, because if somebody's dissociative, that's just going to take us a little bit more time, though I tend to assess attachment through basic questions, not a specific questionnaire, more so on that for assessing time. And I won't get too much into assessing time, because that's a whole module in the course on how to do that. But as far as weeding out clients, I'm looking for those people that have enough stability to be able to come in, really do the work, and then take that. And we do the integration work of a lot of future template stuff. That's the end of the intensive. But then to take that and really start applying it to their life. The clients that need more maintenance, then it depends on if they have that already set up to do.
Yeah, thank you for all that information. I wanted to ask you, Sadie, you mentioned the course. Can you talk a little bit about the course? What are people going to learn? Obviously, they're going to learn how to do EMDR intensives, but if you can, talk in more detail about what modules you have, what are you actually teaching in the course? Yeah.
Mhm. Yeah, that's a great question. Thank you for asking. And so Kelly and I put together a course because I started having more and more calls for consultation on people that want to do intensives. And so we put together this course on how to do an intensive, how to transition your practice from being an hourly practice into doing intensives. But with the idea that there's no one right way to do intensives. I can tell you how I do them. Kelly does them slightly differently than I do. And we run our practices very differently for different reasons. And so our goal was to give people ideas on how to do intensives with lots of different options and ideas so you can figure out what's going to best fit your schedule and how you want to be able to structure your schedule and how you want to work. And so in the course, we talk about the benefits of working intensively, which I've kind of mentioned this morning, but there's a little bit more detail on that. We do a Mythbusters module on the fears and concerns, the ideas, the myths people have about intensives. And we really show people they're not as big and scary as they seem, both for clinicians and clients. We do a module on the research that's behind intensives and working intensively. I mentioned Ricky Greenwald's work. He did a research study on doing intensives and how effective it was versus people getting the same results as people doing hourly therapy, but in a much shorter period of time. There's a research study on doing intensives with with combat veterans. There's Ad de Jong, Susie Matheson from the Netherlands. They're doing intensives. There's 2 studies on some of the work that they're doing. So we dive into the research and really show you, but our main goal in showing the research is to show it's effective, but also all of those people, those research studies are set up doing intensives in different ways. And they're all showing really positive results. And so to show you that there's different ways to do intensives and that there's research behind it, not just to get insurance companies to pay for it. And then we also talk about how I structure my day when I do an intensive. I talk about that and how I structure working through a client's treatment plan. We talk about the different kinds of intensives, like I mentioned, the extended session versus the ongoing traumatic, more recent event intensive, and then the full story clearing, childhood through adulthood, clear your whole story intensive. So we talk about the different kinds. We talk about how to determine how much time you need to book for somebody, how to figure out how to charge for that. We offer scripts for here's how to talk to your clients about an intensive. Here's how to talk to your clients that are hourly clients that you might want to transition to an intensive to clear up your caseload so you have time in your schedule to do intensives. Here's how to talk to your other colleagues and how to collaborate with them. A lot of times I have a couple couples counselors, couples therapists in Denver that I collaborate with, and they'll send people to me to do an intensive as they do the couples work, and how to market yourself. We do a lot of how to figure out your plan and your budget, because if you're going to transition your practice, you need to have a cushion on, as you stop taking hourly clients and start taking intensive clients. We talk about the different ways to structure your schedule, your practice. What else do we talk about? We do a couple case examples on how to work through a treatment plan, whether it's that ongoing traumatic stress or it's the full story clearing. We talk a little bit about how to treatment plan. Kelly offers how she does it. I offer how I do it because they're slightly different. And then we give case examples on how to then, okay, I've got this treatment plan. How do I work through that in an intensive? I mean, really taking the skills you have as an EMDR clinician and applying that to the intensive, because we're not teaching you how to do EMDR. We're assuming you already have the basics on that. We recommend that you're at least certified before you start doing story clearing intensives. But if you're just finishing your basic training, there's still a lot you can do with extended sessions or the more ongoing traumatic stress intensives. We talk about a toolkit and how to build a toolkit of here's the different tools that we recommend you have, whether they're advanced trainings or specific protocols or scripts on and how to do what you need for the different kinds of intensives. So it's a really thorough program on how to do intensives, the different kinds of intensives, and how to transition / create your practice the way you want it to fit your life.
Yeah, I like that you said that there are different ways of doing intensives, and I'm wondering about um, if it can be done virtually.
Yeah, that's a great question. The answer is yes, I think so. And by that, what I mean is I absolutely believe they can be done. I personally haven't done a lot of that. So I want to speak to it with that on the table. I know Kelly's done a little bit more of that. Kelly tends to do shorter intensives. She works more with the recent and ongoing traumatic stress than she doesn't do as much of the story clearing intensive. And so she'll do, because like a 5-day, all day on Zoom intensive, I wouldn't do with somebody. I think you could do. There's no reason not to, other than that's way too much time on Zoom for anybody. And Zoom is so much more exhausting, as we all know from having done Zoom therapy for the last year and a half. And so what I know Kelly does is she'll do like a 3 or a 4 hour session. And then she might do that for 2 or 3 or 4 days consecutively. So it's more of that 3 hour session and then doing those consecutively as an intensive that way. I haven't done that, but I would do that with a client that wants to work through that more recent or ongoing traumatic stress. If somebody wants to do a story clearing intensive, I really recommend that they come see me in person. And that's where people will come in from out of state. And most people don't want to do that much time on Zoom. They'd rather spend a few hours on an airplane. So you can do it virtually, but I think there's some limitations to it just based on Zoom fatigue.
Yeah, that makes sense. Okay, Sadie, one more question before we say goodbye. And this is a question, this is my personal obsession. And the question is, how do we get better? How do EMDR therapists get better at being EMDR therapists?
Yeah, I love that you asked that question. And I'm so glad that that's your obsession, because it's good to hear. So my thoughts on that, my first thought is, and this was something I resisted for a long time, just because it's a few extra steps and it's kind of a pain, but I've really seen the benefits of doing pre and post assessments with my clients, as if you're doing research. And by that, I mean, tracking symptoms, whether you're doing this hourly or in an intensive, doesn't matter. However you're doing your practice, when a client comes in, I give all of my clients that first morning when they fill out the DES and the ACEs and all of the other paperwork for me, I have them fill out the HADS, the Hospital Anxiety Depression Scale, and then I also use the PCL-5. There's a handful of different tools that you can use. I like those two because they're short and fast and easy. And depending on certain things, sometimes the PCL-5, because that one's very much on PTSD, that's based on single incident PTSD. So if somebody doing a story clearing intensive, I might just give them the HADS, or have them focus on something specific with the PCL-5. But I do a pre and a post, pre-intensive, post-intensive. And the post-intensive, I usually send it to them 30 days out rather than at the end of the intensive. And then being one, I find clients love being able to see those scores and see those numbers change. That makes me feel good. It makes them feel good. But it's also a great way to know, is what I'm doing actually working? And I'm actually testing it and really putting numbers in. And I'm not doing research on it, but you could. And so whatever assessments you want to use, I really encourage people to test your work. And then that motivates you to find where you could do better. And that's my second thought on how do we be better EMDR clinicians, is just don't stop learning. I find, because I volunteer with Trauma Recovery HAP and do a lot of the basic trainings, and I do a lot of consultation for basic trainees. And I really, really recommend people get certified. Once you get your basic training done, go on and get certified, find a good consultant that you really click with. But then even after you're certified, you don't have to go on to become a consultant, but don't stop taking advanced trainings. I know once I got trained in EMDR by HAP over a decade ago, every CE that I've ever paid for or done a training for to renew my license has always been an EMDR training, just because if I'm going to spend money, I want to learn something I'm actually going to use in my office, was my first thought. But that's where I really become a well-seasoned, well-rounded clinician, is by taking a lot of the advanced trainings. So find the things that you enjoy working with, find your niches, but also have some real general skills. But just don't stop taking the advanced trainings, because that's really where you really learn how to be a really efficient EMDR therapist, and not just somebody that knows the standard protocol and can do that with just basic things.
Yeah, that's a really good answer. Sadie Smith, thank you so much for your time.
Yeah, and if I can make one last plug, if anybody's interested in this course, go to the website scalingupemdr.com, and then under the trainings tab, there's a handful of trainings, but there's one on intensives. If you're interested in that course, we have 2 different options, price points. So feel free to go check that out. If you want more information on doing intensives, that course will give you lots to work with.
Yeah, and we will link to everything we talked about. So whether if it's the course or research on the efficacy of EMDR intensives, we're gonna link in the show notes below this video or the podcast. So all this information will be available.
Yeah, and you can link. I'm happy to do. If somebody wants to do consultation on intensives, I do that as well. So you can stick my website in there, and people know how to reach me. Happy to help however I can.
Yeah, we will link to that as well. Sadie, thank you so much.